Hello everyone, hello and hello. Welcome everyone, welcome to today's SDG series. And today we are going to talk about SDG 3. है ना? SDG 3 क्या है? What are the actual impacts of SDG 3? Sustainable Development Goal 3. है ना? So dear all, let me share my screen first and then we will start our wonderful session, right? And whenever I used to talk about SDG 3. So I think it's very important. I know that zero poverty is also important, but I think without SDG 3, life is also not like that. Whatever we used to think, whatever we used to study, we may say that. है ना? So ensuring healthy lives and promoting well-being for all at all ages, right? So you know I would like to again wish you all very good evening, everyone. Today, I am going to speak about Sustainable Development Goal 3, which is all about ensuring healthy lives and promoting well being for all people at all ages. This goal is not just about treating diseases, it's about prevention, promoting healthy lifestyles, improving healthy systems, you know, and making sure that healthcare is accessible to everyone regardless of where they live or how much they earn. SDG 3 is at the very best heart of human development because without health, there can be education, no work, productivity, and no strong societies. Over the course of the session, we will explore the challenges, progress we made, the setbacks we have faced, and what lies ahead as we move closer to the year 2030. Because we have a need to fulfill the goal until the year of 2030, right? It's a comprehensive look at the global agenda for health challenges, progress, and the path forward to 2030. Now, next, the global health challenge. है ना? Why SDG 3 matters? There are those who are asking for the certificates. It's mentioned in the description. What? Please go through that link and you will also get the certificate within 24 hours, right? So please don't disturb with the messages on my WhatsApp. Okay. Whenever I should talk about the global health challenge by SDG 3, so dear all, Sustainable Development Goal 3 is not merely an aspiration, it's a critical imperative for global stability and prosperity. The health of the population underpins its economic productivity, social cohesion, and overseas resilience. Despite significant strides in medical science and public health, profound disparities and persistent challenges continue to threaten human well-being on a massive scale, like child mortality rate, maternal health, non-communicable diseases, NCDs. Means when we used to talk about SDG 3, we must first understand why it matters so deeply, right? Health is not just a personal concern, it's a global concern. The health of a population directly affects a country's economy, productivity, and stability. If even if technology and education are advancing, right? So if people are unhealthy, the entire progress of nation is slowed down. Despite incredible progress in medical science, millions of people will lack access to basic healthcare, vaccines, or even clean water. SDG 3 addresses the imbalance. It reminds us that health is a human right, it's not a privilege, right? Privilege. And unless we bridge the gaps in healthcare, we will continue to face instability, poverty, and inequality. So, real, it's all about it. Whenever I should talk about child mortality, in the year 2023, over 5 million children under 5 years old tragically died, with many of these that being preventable causes such as pneumonia, diarrhea, and malaria, and some of the global life expectancy, a fundamental measurable of population health, saw a significant drop from 73.1 years in 2019 to 71.4 years in 2021, right? And whenever I used to talk about, I think my PPT is not visible. Just wait, dear all. Just wait. Yes, that was not visible. No. Okay, it's visible again. Okay. Ha. Okay. COVID 19. Whenever I used to talk about COVID 19, so I was talking about the declining life expectancy. This reversal reflects the direct mortality. है ना? Always reflect the direct mortality from the virus and the indirect impact of overwhelmed health systems and disrupted essential services. Rise in TB and malaria deaths. Uh, Disruptions to diagnosis, treatment, and prevention programs led to an increase in deaths from tuberculosis and malaria compared to pre-pandemic levels. This highlights how global health crisis and exacerbate existing disease burden, right? Because I already told you all, vaccination decline. Childhood vaccination rates plummeted to levels not seen in 30 years. The diversion of resources, lockdowns, and fear of infection led to millions of children missing routine immunizations, risking resurgences of preventable diseases like, we used to say measles or polio, right? So these are all about, you know, progress and success stories. Dear all, despite the challenges posed by, we used to say that, recent global crisis, significant progress has been made towards achieving SDG-3 targets. Now, these successes that demonstrate the power of sustained investment, innovation, and global collaboration in public health. Under 5, mortality, neglected tropical diseases, NTDs, NCDs also adds related deaths, vaccine and medicine innovation, right? These achievements provide crucial momentum and living experiences for future health initiatives, providing that targeted efforts can yield significant positive outcomes. Right? It's all about that. Universal health coverage, the cornerstone of SDG-3. We all know that we have a somewhere, we have problem, but how we can overcome, how we will cover that gap, it's important. Universal health coverage (UHC) is not just a health objective, is but it's an objective, but a social and economic imperative. It embodies the principle that everyone, everywhere, should have access to quality health services without facing financial hardship. The core aim of UHC is to ensure that individual and communities receive the health services they need, from health promotion to prevention, treatment, rehabilitation, and palliative care, without being pushed into poverty. This means addressing both the availability of affordability of services, persistent inequalities, coverage gaps. Despite UHC being a central tenet of SDG-3, significant, uh, what do we say? Significant inequities persistent globally. Rural population, the urban poor, and other marginalized groups continue to be underserved and often lacking access to even more of basic health services. Financial barriers, geographical distances, discriminatory practices contribute to these disparities. Right? So it's all about, dear all, it's all about what? SDG. SDGs मैंने आप लोगों को बोला केवल ये नहीं सिखाते कि SDG हमारे क्या है, SDG हमें ये सिखाते हैं एक्चुअल लाइफ क्या है. Coverage gaps, exactly. When I used to talk about coverage gaps in many low income countries, the coverage of essential health services remains below 80%. This gap translates into millions of people unable to access life-saving interventions, routine checkups, necessary meditations. Strengthening primary healthcare is key to closing this gap, ensuring that services are delivered closer to communities. Right? And those again who are asking for the certificate, please go through the description. जो भी लोग मुझसे पूछें सर्टिफिकेट के लिए, डिस्क्रिप्शन में जाइए और प्लीज उसको देखिए। फिर डिस्क्रिप्शन में आपका लिंक दिया गया, प्लीज मेरे फोन पे मैसेजेस आ रहे हैं भाई, इस चीज को ध्यान में रखिए प्लीज, है ना? ओके, कम ऑन द नेक्स्ट, टैकलिंग नॉन कम्युनिकेबल डिसीजेज एंड मेंटल हेल्थ। Whenever I should talk about mental health, communicable diseases, how will be able to tackle that? Because we all know that problem is everywhere and every time, but we are the humans, we are have a tendency to tackle the task, tackle the problem, tackle the diseases, tackle to the mental health. While infectious diseases often grab headlines, non-communicable diseases (NCDs) pose a silent escalating crisis globally, coupled with a growing awareness of mental health importance. SDG-3 places significant emphasis on addressing these personal health, right, challenges. NCDs reducing premature deaths. A key target of SDG-3 is to reduce premature mortality from major NCDs, right? One third by 2030. This inquires as it requires comprehensive strategy focused on prevention, right? Early detection, effective management of these conditions, right? मैं अगेन बोल रहा हूँ, जो भी लोग मुझसे सर्टिफिकेशंस की बात कर रहे हैं प्लीज डिस्क्रिप्शन में जाइए और चेक कर सकते हैं। Mental health promotion and suicide prevention. Recognizing to the immense burden of mental illness, SDG-3 integrates mental health promotion and suicide prevention, an integral component of progress. Right? This involves destigmatizing mental health issues, improving access to mental health services, and incorporating mental health care into primary health systems. Substance abuse prevention. The goal also includes the strengthening of the prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol. Comprehensive public health approaches are vital to address the societal and health impacts of substance abuse. Right? Come on, the next one. Sorry. Environmental health and safety, reducing pollution related deaths. I was saying the environment plays a profound role in human health. SDG-3 explicitly recognizes this link, setting targets to mitigate health risks associated with environmental pollution and hazardous substances. Right? Hazardous chemicals and pollution. SDG-3 aims to substantially reduce the number of deaths and illness from hazardous chemicals and air, water, and soil pollution and contamination by 2030. Air pollution alone in the linked to over 7 million premature deaths annually worldwide, primarily from NCDs like stroke, heart disease, and lung cancer. This necessitates cleaner energy resources and industrial regulations. Occupational health is also a major cause. Water sanitation and hygiene. Whenever we used to talk about water sanitation, access to safe water, sanitation, and hygiene, wash is critical for preventing infectious diseases like cholera, typhoid, and diarrhea. Poor wash conditions contribute to a significant global disease burden, especially in vulnerable populations. Occupational health, a healthy environment also encompasses safe workplace. Protecting what? Protecting workers from chemical exposures, imposers, physical hazards, and ensuring adequate safety measures contribute directly to SDG-3. So, they are intervening at the intersection of the environment and health requires a holistic approach, promoting sustainable practices and strengthening regulatory framework to protect human health and environmental degradation. Here, it's all about SDG. I was saying no, it's not all about only study. SDG is exactly very wide topic. The road ahead, accelerating progress to 2030. With 2030, Uh, Fast approaching accelerating progress on SDG-3 requires a renewed commitment, strategic investment, and innovative approaches. The lessons learned from the COVID-19 pandemic underscore the urgency of building resilient health system that can be withstand future shocks. Investing in resilient health system post-pandemic, there is an urgent need for increased and sustained investment in health infrastructure, workforce development, and supply chain resilience. This includes strengthening primary healthcare as the foundation of UHC and enhancing preparedness for health emergencies. Whenever we should talk about leveraging science and technology, harnessing the power of science, technology, and innovation is crucial for achieving equitable health access. This includes digital health solutions, telemedicine, advanced diagnostics, and research into new medicine vaccines tailored to global health needs. Strengthening global partnership, collaborative action, and equitable financing and vital international cooperation, South cooperation, and multi-stakeholder partnerships are essential to move resources and share knowledge to ensure that no country or individual is left behind in the pursuit of health at all. Right? Now, dear all, come on the conclusion. We would like to conclude our topic. Why it's also mandatory. Okay. Together for health. Our call to action. It's a time to call to action. And again, those who are asking for the certifications, I am again telling to all that please check the description box because my phone is ringing continuously. I made silent to my phone. I have muted my phone, but still again calls are continuously appearing on my screen. Only for what? Certificate. So please, those who require certificate, please go through with the description box and you will get that link. Okay. Come on next. Uh, whenever we used to talk about SDG again and again and again, very, we used to say very sensitive topic it's all about. Because, whenever we used to talk about that, for government, committees, and individuals, government must strengthen health systems and ensure accountability. Committees must demand better action support vulnerable groups. And individuals, we must make healthier choice in our own lives, eating better, exercising, getting vaccinated, and looking after our mental health. Every small step contributes to a larger impact. Together, we can make health and well-being a reality for all by 2030. Right? So, thank you so much, everyone, for this cooperation. Those who are again asking for the description box and the link of the description box. So, again and again, I am telling to you all that what it's not here all about that to getting the goal. It's all about your knowledge also because it's also a key point. Those who are asking for the certificate, please do check the description box and you will get your certificate within 24 hours. Thank you so much, everyone.